So I'm interviewing Carlos Barea Jr. He's a physical therapy assistant here at Laredo Sports Medicine Clinic. Would you like to tell us your title and describe your primary role in the setting?
Physical therapist assistant, and basically what I do is I manage the care of patients from day to day. The physical therapist see them first, evaluate them, but then the physical therapist assistant see the patients every single, the days that they do come into therapy, and pretty much manage the whole, their whole like physical therapy session and all that.
All right. How many years of experience do you have working in this setting?
It'll be 1 year. Yeah, 1 year.
Just make sure.
Oh, I'm so sorry. No, that's good.
What are the total number of years you've been practicing for PTA?
Same about a year. This is my first job, but I would say maybe let's give it a year and a half with like clinical rotations and all that.
Right. So, what interests you in working in this type of setting?
I really like helping other people. Before I was a car salesman, so I would sell a lot of stuff. And I wasn't really making the money that I wanted to make, so then and also I wasn't making it the way I wanted to make it. I felt kind of bad about selling people cars that they didn't need to buy. So I decided, hey, I'll go back to school. I had already worked as a tech previously for the same company, so I knew pretty much what goes into the job.
Okay.
So basically, yeah, that after I didn't really like being a car salesman anymore, I was like, I decided I'll go back to school, become a PTA.
Yeah, you already had that experience with like helping out people. So
Yeah.
I'll help you more with this.
Yeah,
particular
definitely.
job setting.
And like I said, I worked as a tech, so the tech works directly under the physical therapist system, so I pretty much knew what the job entailed.
Okay. What is your work schedule and what are some of your daily duties that you do here?
I come in at 9:30 and my last patient is at 6:30. So about, I would say 9:30 to around 8. And then other than just having patients and like doing the care for the patients, I myself here at this particular clinic, I do the schedules for all the techs. So I have to, if they have a school schedule that they work around, or if they ask for like days off or whatever, I'm the one that makes the daily schedule for them. And every week it's constantly changing and all that. So, and that's pretty much what I do here besides patient care.
Can you describe the type of patient population seen in the setting?
I would say they're more advanced patients in the sense that we don't see a lot of like elderly people, or like basically if you can come to this clinic, it means you can stand up and walk and all that stuff. This is more of a sports medicine, but that's not all we see. We do see some elderly patients, but like I said, this is an outpatient clinic, which typically means if you're coming into this clinic, you can walk, you can stand up, typically more or less. But like we don't see like all the, I guess, patients that are bed bound or in hospitals and stuff like that. Like just everybody that usually comes here, and also that's who we accept mostly. If there's a patient who's had a stroke or something like that, we typically don't see them just because we don't have the equipment here for that.
So it's basically like from kids to like, I'll say adults, sometimes elderly.
Yeah, so we see a lot of like border patrol agents, firemen, customs. We do a lot of work with the government. So like police officers, if for whatever reason they get injured on the job, we see them here. We do a lot of work with like the teachers, coaches, students. If any student gets hurt like at a sporting event, we see them here because we work with that insurance.
Okay. Can you describe some examples of patient diagnosed of PTA? Can expect to treat like
here specifically ACL tears. So this ACL tells for the knee, rotator cuff for the shoulder, low back patients, a lot of like sprained ankles usually. Mostly what we see is like a bunch of sprained ankles, and like like I said, so like basically his knees, shoulders, ankles.
knees, shoulders, ankles.
Yeah.
Okay. So how many patients would you say you take on a daily basis?
It's been kind of low with the COVID situation, so I would say right now I saw today around 12 patients.
12 patients.
But on a normal day, like a very, very busy day, I would say around 20.
Right. So since you're a PTA, you work under the PT. Do you work with him a lot, or would you say?
Well, we have 3 PTs here actually, and we see all of their patients. But yes, so typically most of the patients that we get here, I already have an idea how to treat them. But yes, if there's something specific that I'm not sure, or maybe it's a surgery I've never seen before, or the patient's not getting better, in that case I will go to the PT, and they literally work in these rooms that are right here. So it's very easy to just go up to them and be like, hey, this patient is this and that. I wouldn't say I communicate with them too much, but not because of the fact that I can't. It's just we really don't need to. Our notes are very, very detailed, so all the information is usually in there. And then with our doctor, we have a very specific surgeon also over here that works here, and so his protocols are already set in stone. So once we get a patient that's come out of surgery, we have an idea of, well, this is what we're gonna do, and this is what we can do for this amount of time.
Okay, so you would get like, let's just say like the PT's notes already when the patient comes in?
Yeah, so like they'll see the PT first, they'll get evaluated, and maybe typically about a couple days later, like 2 or 3 days, they'll come in and see us, but the notes should already be ready by then.
Okay. What factors do you consider when delegating patient care to a PTA or aide?
Just how difficult the patient is. I mean, some patients require a lot of one-on-one care, and some patients just come in to do exercises. Typically the patients that require one-on-one care or a lot of like hands-on stuff, I take them, and then once they get to the exercise portion of their treatments, I usually just hand them off to the tech, who pretty much covers all that stuff.
Okay. How do you supervise a PTA or aide?
So here we all work in a huge gym over here, and so we're all kind of in the same room with each other. So if the tech or the aide needs me, I'm literally about 5 feet away, either working with another patient at the computer doing my notes, or like in the back. There's only like rare times where, let's say I'm doing a massage, so I'm in the back of the private room, but even then, maybe 15 feet away, they can just come in if they need have any questions or anything.
Okay. What are some expectations of a PTA beginning to work in this setting?
You gotta know how to manage your time very well, because here we see a lot of patients all at once. Here we have a huge volume of patients, so like I said, once we get to the point where we're seeing 20 patients a day, communication is very key. And you need to be able to, like, I need to be able to see this patient, I'm gonna do this with this and this with this patient. This other patient's gonna come in right afterwards, I'm gonna do this and that. And also be able to adapt, because sometimes, let's say a patient comes in 15 minutes late, we still have to see them. So it's kind of like, okay, now I have to do this or that.
Yeah, so patients will probably be like the #1 thing to have working.
Oh yeah, definitely.
Especially with patients that, you know, sometimes are probably difficult.
Definitely, and I will find, I used to be a server, and nothing is as difficult or dealing with difficult people as that. Here, it's a cakewalk. Usually people know you're trying to help them, so they're pretty calm. The only thing that gets difficult is everybody has a different pain tolerance. Some people come in with surgery they had 3 days ago, they're fine. Other people, they'll have pain for like 3 months straight, and it's just, I don't know if it's something mental that went on, that they just don't deal with pain well, or maybe something went wrong during the surgery. But for some reason, some patients have more pain than others. You just got to be a little bit more patient with them.
Yeah, my grandma, she recently got surgery on her knee, and she goes to physical therapy, and she tells me that like what they do, like the different treatments and stuff, like she sometimes like yells because
it's so painful.
Yeah, it's so painful that she can't stand it.
And I guarantee you that same surgery, there's somebody who comes out of it and they're completely fine.
Yeah, she was saying that there's other people who have like similar, they've gone through similar stuff, and that they
recover.
Cakewalk, recover easily, and they're walking again or whatever.
And like I said, a lot. I mean, I don't want to say something wrong with the surgery, because a lot of times the surgeries are usually fine. Like it's usually just a person's pain tolerance. Like it has a lot to do with it. Some people just have a lot more than others.
Okay. Can you describe the importance of communication between the PT and PTA?
Very important. Like the PT basically lays out the roadmap that we have to follow. They're the ones that do the evaluation. They know how to do all the tests. They can like touch your leg and they know exactly what's wrong with it. So they tell us what to do. And not in the sense that they're very specific about what to do, but they'll give you like goals that you have to meet. And it's up to you to decide how to meet those goals. They'll be like, I want this patient to be able to bend their knee this much by this time. And so you just gotta figure, it's up to you. They're not gonna give you specific exercises to do, you gotta figure that out on your own.
Okay. How valuable is the PTA in this setting?
I would say very, because we're the ones that see the patients. And the physical therapist will see them the first time, do the evaluation, and for the next 6 weeks, usually, we'll see them twice, 3 times a week, whatever their frequency is. And we see them, we're the ones that see them face to face the most, and then they'll go back to the PT for a re-evaluation after that.
Yeah. Okay. What changes have you seen in the profession during the time that you have practiced?
Not that much. Like I said, I've only been practicing for about a year. So from when I graduated to took my test and now, nothing really. I would say the only thing that changed this last time, and I had to renew my license, was that I had to take a class on, child trafficking or human trafficking. So I guess just that would be the only thing.
Was there any thing different with like when the COVID started?
Oh yeah, definitely. So of course we had to don the masks. We had a whole process over here where we couldn't have anybody waiting in the waiting room. So the patient had to call beforehand. Also, we kind of like stayed, in the beginning, we kind of stayed away from like the elderly patients just because we didn't want to expose them in this type of setting. But the cleaning, definitely. All of our patients that we had scheduled, most of them didn't show up at that time. So we had a severe drop in our patient load. And then, what else happened? Okay, and yeah, so then there's a bunch of stuff where it's like, oh, if somebody's sick, if somebody shows any symptoms, if they're even just like tired a little bit, we can't see them. Like you have to go get tested and come back to us and we'll see you again. Basically like stuff like that. But then also another thing that happened is our surgeons, since they didn't have access to the hospitals, they couldn't do surgeries anymore. So for a long, that also dropped the patient load a lot. And then on top of that, sometimes what doctors will do is if you need surgery, they'll have you come to therapy first, and then they'll do surgery afterwards so that you go into the surgery a little strong. Well, all those patients that were going to therapy at that time had pretty much their surgeries put on hold for 3 months. So basically, we're still seeing them for 3 months. We can't advance them because they're in a lot of pain, and there's nothing we can do basically because they need surgery.
Okay. How has the field of physical therapy differed from your expectations before entering the profession?
I didn't really have any expectations as going in. My dad does this too, like I said, so I've known more or less what physical therapy was. It wasn't until I became a tech that I actually learned like all the different, I guess what I did like a lot is how creative you can get with like exercises and patient care, because it's all like problem solving. Every patient's different, so everybody requires a different approach to how you give them their therapy. And I guess that's the only thing I just never thought of was like, okay, we're just gonna do these exercises and they're gonna work. It doesn't always work out that way.
Yeah, the more I learn, the more like it surprises me that like there's different exercises. Because like usually when people think of physical therapy, it's just like scratching, massages.
Yeah.
It's kind of more complicated than that.
And like I said, there's some exercises that I've learned that I would have never thought of to do, but then you see somebody doing them, and you're like, oh, that's a great idea. Like, it's just like little things, and it all stems from like you're gonna get a patient one day who is not gonna be able to do that exercise, so you have to figure out something else to do, and that's how you just start getting creative.
Okay. What are some of the challenges for the PTA working in this setting?
In this setting, it's just definitely the volume of patients. Like I said, you have to be very, very good with your time management. So here at this setting, we see patients every 30 minutes, but we gotta see a patient for an hour. So you're seeing a patient for an hour, but then at 30 minutes, you're gonna get another patient. And then at 30 minutes, you're gonna get another patient. And we've gotten to the point where we have double books, which means, so let's say at 1 o'clock, I'm gonna have one patient, and at 1:30, I'm gonna have 2 other patients that are gonna come in. So I have to know exactly who those patients are, what's wrong with them, what I'm gonna do with them, so that when they do come in, I'm ready and I'm not like running around like a crazy person.
Yeah, so you have to have like that already like in your head, like, okay, so this person has this, whatever.
Yeah, and so I'm gonna do the massage here, then I'm gonna get them started with the exercise, I'm gonna give them to a tech, and then the next person's gonna come in so I can do that massage, and then the next person comes in who needs like whatever, you know? So like, it's just basically good timing. Like I said, if one patient even comes in like 10 minutes late, throws out my whole plan. That's where you gotta kind of like adapt.
Okay. And last question, as a pre-PTA student, what practical advice can you give me regarding the physical therapy profession and the role of the PTA within the profession?
I would say get a good grasp of anatomy. If you can have a good grasp of anatomy, all like the extra creative stuff, like where you're just trying to figure out exercises and all that, it'll become a lot easier if you understand anatomy and the way the muscles contract, retract, the physics of it all, like what happens when you do this motion. If you can get a good grasp of anatomy, all that other stuff starts to make sense and fall into place.
Yeah, I know a lot of people have trouble with anatomy.
Yeah, exactly. Especially like the muscles are the most important. The muscles are the hardest because there's like 700 of them. But if you know like where a muscle, like the bicep, for example, if you know, and to be fair, there's like 3 different biceps, but like this specific motion does this. So you're like, you know to target that area. Or a patient says this hurts here. And you're like, does it hurt when you do this? No. Does it hurt when you do this? Yes. And you're like, okay, then it's this particular muscle. We can do this stretch, we can do this exercise, and we should avoid these exercises, you know, stuff like that.
All right. Well, that's pretty much it. I want to thank you for your time.
No problem, man.
I know it's late.
No, it's
It's
okay.
been a long day.
Don't worry about it. Actually, I'm getting out early today, so it's a good thing.
That's good. All right. Well, that's pretty much it. Thank you for your time.
No problem, man.
Yeah.
All right. Sounds good.